Good afternoon and welcome to the Cambridge Health Alliance Health is Well. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And today we have with us Dr. David Becker, who is a general and colorectal surgeon with the Alliance.
That's right.
Hey, I got it right. So thank you for coming on board, Dr.
My
Becker.
pleasure. My pleasure. Thank you.
So today, what would you like to start talking about? Would you like to tell us a little bit about your background and about CHA, what we do there?
Sure, absolutely. My name's Dave Becker again. I'm about 1 year into my time here at Cambridge Health Alliance. I'm a general and colorectal surgeon. Before that, I was up in private practice on the North Shore of Boston for 15 years. And before that, I was a surgeon in the military for 9 years.
Oh, what branch?
I was in the Army.
Oh, the Army. Well, thank you for your service to the country.
You're very welcome. It was a very exciting time to serve. Here at the Alliance, I run a surgery clinic several times a week. I go out to Malden and to Revere as well in the outpatient clinics.
Where is the surgery clinic? At Cambridge Hospital? Or?
I see patients mostly at Whidden Hospital.
Whidden in Everett.
There's a separate surgery clinic also at Cambridge Hospital as well, run by my colleagues. And I also go out to to Malden, and I see patients also in Revere as well. I see surgical patients. And it's been great. I absolutely love the Alliance. My wife works at Children's Hospital, so we're kind of moving down toward the city, which is why we switched here. But it's been great. It's a very caring, well-staffed organization. There are a lot of kind of physicians sort of in the middle of their career, so they have a lot of energy. They're very well trained, and I've been absolutely pleased. I wouldn't want to practice anywhere else. It's excellent.
Well, that's wonderful. And my experience where I do the TV shows and I take doctors out, and as you know, because I've dragged you out there into the community, every single doctor that I have ever taken out, it's very clear to me that the doctors at the Cambridge Health Alliance really care about their patients. I mean, I've really been incredibly impressed by that. And it doesn't matter what kind of doctor they are, because whether it's the feet or the brain or anything else in between, that's been my experience with the docs at the Cambridge Health Alliance. So thank you.
Oh, it's a pleasure. We live in a very interesting part of the world. There are a lot of different people from many different backgrounds as patients,
For sure.
Many different countries, and I think it requires a certain sensitivity and ability to listen to patients and to really take the time to get to know them to provide good treatment for this population. So
absolutely, and actually on that note, have to learn a little bit about the cultures, because what might be acceptable in one culture might be totally taboo in another culture, and fortunately we have interpreter services on board, folks of those different cultures that may have a little more information than we do and guide us along.
That's absolutely right. And we have an excellent interpreter system. It works very efficiently. So it's
so you're able to work on anyone from any country in any language.
Yeah, no, it's extraordinary.
Yeah.
And what's interesting is even with the different languages, it's surprising how similar. Everyone has sort of the same concerns about their health. Once we can get the translation going, everyone needs to be taken care of with respect and dignity and
For sure.
and to be a good listener to them.
Yeah, which is, as we were talking before the show, the doctors of today do listen to the patients. Where years ago it was like the patients weren't allowed to say anything. So I'm glad you came along in this generation. So we're here to talk about colon, diseases of the colon and maybe the intestinal tract and things of that nature. And we all know about that. And especially as we walk this highway of life, we may end up, it's my experience that our needs never seem to decrease. They only seem to increase. And we can kind of get different conditions along the way. So what are some of the things that you see in your practice? What's the prevalent thing that you see?
Well, my specialty is general and colon and rectal surgery. So, I do surgery and take care of patients with diseases really that are kind of in the abdomen. So that can be anything from gallbladder problems to appendixes to problems with blockage in a small intestine to large intestinal problems such as colon cancers, and also, you know, your garden variety hernias and things like that. I think that in my practice, especially in the colorectal side, I also see patients with a lot of diseases that have to do with proctology, things like hemorrhoids and infections down around the anal area, and you know, also some issues when people generally have sometimes problems with abdominal pain or constipation, or problems with continence. In other words, they have trouble controlling their bowels. This is kind of a wide range of things that we see.
So let's talk about, of course, I think everyone understands and knows quite well what constipation is. And but so what are some of the contributing factors to constipation? Is hydration one?
Well, you know, the colon naturally, when you eat something, the food kind of works its way from your mouth down through your small intestine, which is about 21 feet.
Isn't that amazing? That is so amazing that we fit 21 feet right in this space. It just is amazing.
Well, there's 5 more feet, actually. After that comes your large intestine, which is your colon. And your colon kind of makes a sort of a horseshoe shape around your body. And it's in that last 5 feet that sort of the liquid part of what you've eaten kind of gets absorbed. And that's how you go from kind of, you know, a liquid stool, if you will, to, you know, a firmer stool that you see. And, you know, pretty much that natural squeezing process and moving process can be affected by so many different things. In general, things like how much you drink, hydration and exercise.
Would that be water?
Can contribute
We're talking
to that.
like water.
Sure, exactly. And then I think what kind of tends to trip people up, especially as we get older, is people go on a lot of different medications. And one of the side effects, unfortunately, of those things is to kind of slow things down a little bit. And so, you know, there's sort of a natural, potential problem that gets sort of worse with the different medications that people are on.
So then do we have to give them something to counteract the medication?
Well, you know, these things, every individual has to be kind of listened to and decide what we think is sort of the problem. Because as you can imagine, in that whole progress through your intestinal system, there are a lot of different things. So you sort of have to focus on that individual person. What are their different meds? Are there some meds we could maybe switch out? Is there things we can do with diet and exercise to improve things? And then there's things, can we make changes in the diet also? Things like, you know, adding more fiber to someone's diet. Fiber and fluid sort of work together. The fiber sort of draws the fluid into the stool and helps things kind of move better through the system.
So fiber, we get that from fruits and veggies?
Fruits and vegetables, and then, you know, there's all sorts of supplements, as you probably know. You know, we sort of really recommend that you get in the 20 gram of fiber range. And so sometimes, you know, we can try things like Metamucil or Citrasil or Benefiber. These are all supplements that you can get, you know, at the drugstore.
What about probiotics? Go ahead. Probiotics, you know, it comes in the herbal, not necessarily prescription.
You know, I don't know that from my point of view as sort of a surgeon, I haven't really dived into that part of it so much. I think that's one of those things you can kind of experiment with and see if, you know, maybe it helps. Certainly in some situations we want to, you know, some diseases of the colon. When people have been, for example, on antibiotics for something, sometimes that can kill off the good bacteria in the colon.
Is that when the condition like C. diff happens?
That is one condition, yes,
right.
absolutely.
I remember my mother would never know how much material she is for me for this show, but I remember that my mother had that at one point, and she was on antibiotics for a long, extended period of time.
So, you know,
and that's why.
That's sort of the role of probiotics, is sometimes to kind of, you know, restore the sort of the good bacteria that naturally kind of live in your system. So
do things like yogurt do that as well? Help us with the flora.
Exactly.
The flora, and I sound like I know what I'm talking about, but a little bit. I know a little bit.
Sure.
So, what other conditions of the colon, the bowel, might you see?
Well, I just want to go back to the,
Oh.
we're sort of talking about constipation. So, again, the recommendation is for people out there, I'd have a long talk with your primary care physician and, have them look at the medications, see about diet adjustments. Sometimes the sort of training yourself to kind of, take a certain time of the day when it's most likely to have a bowel movement, which is in the morning, or after a meal. And if you can kind of sort of train yourself to go at those times, sometimes that can kind of establish a pattern in your body which can help with constipation. So all these things can kind of be looked together, with your primary care doctor. And I think a lot of this stuff can be treated.
So I know I hear a lot, and people ask me a lot about diverticulitis and diverticulosis. And so is there a difference? There's two different names. I would guess that there's a difference between the two. Can you tell our folks what the difference is between diverticulitis and diverticulosis?
Sure, it's not a very complicated thing. As we get older, we sometimes get these little areas on our colon that are sort of thin. I sort of like to tell people it's kind of like a bald spot on your tire. So the colon is a tube, and sometimes little areas can get just a little bit thinned out from sort of being overworked. And when they get thin, they kind of make these tiny little sort of ballooning out pouchings of the wall of the intestine, and that's okay. There's nothing wrong with having those. I do a lot of colonoscopies as part of my work, and we see that all the time. But a small percentage of people will have problems because of that. So in other words, a lot of people in our colon, if you would look, you would see those things, and a small percentage of people can go from diverticulosis, which is having these diverticula, to something problematic, which is a diverticulitis.
So
when you hear
spots,
sort of a little itis, that means something's gone from okay to kind of inflamed. And those little thinned out areas can sometimes pop, just like the way a bald spot on your tire can kind of pop. And when that happens, sometimes people can get very sick or a little bit sick. It's like an infection. And sometimes that requires surgery or sometimes antibiotics. So it's okay if someone is told that they have diverticulosis. You just need to be aware that suddenly sometimes that can cause, problems with infection and fever and pain, and they need to be treated for that.
But not necessarily, right?
Only if there's a problem.
Only if there's a problem. But because you have diverticulosis doesn't necessarily mean you're going to end up with diverticulitis.
No.
Yeah.
Exactly.
Right. And just to ask you, these bald spots that you talk about on the tube, those bald spots are called diverticuli?
They're called diverticula. A single one is a diverticula, and many are diverticuli.
Right. Okay. So, all right. Well, that's good. I'm learning something new. I hope you folks are. So that clears up that. Now, what about when you go in on a colonoscopy? I'm sure if these folks might know, but you want to just quickly tell them what a colonoscopy is, just in case people don't know.
Absolutely. So, to kind of go back a little bit. We like to know in many ways sometimes what's going on inside someone's colon. And one of the most direct ways to do that is to put a little tube up into the bottom that kind of acts like a little plumber snake. It can kind of move all the way around that U shape of the colon. And when we put that in, it has a little camera on the end, and we watch it on a TV screen. And we like to do the colonoscopies for several different reasons. Sometimes it just helps us decide if there's a specific problem that we're looking for the colon, and we might do that at any age. So, someone.
Is there a recommended age that you begin to do these if there's no history in a family?
Well, sometimes people, in their 20s will have some crampy abdominal pain, or children, or 30s, 40s will have maybe some bleeding from their bottom, or some stomach pains, or something that makes us concerned that one of the many different diseases that can happen in the colon is going on. And as I said, one of the most direct ways is to do this colonoscopy. And then there's an entire different reason why we do a colonoscopy, which is to prevent people from getting colon cancer. And what we like to do for that is, generally starting at age 50 or earlier, if there's some concern, is we sort of recommend a kind of a routine colonoscopy about every 10 years or so to look inside the colon. And at that point, we're looking for things called polyps, which are little kind of growths inside the colon that can sometimes turn into cancers over time.
So you remove those on the spot?
Yeah,
usually?
exactly.
Yeah, right away.
So kind of the experience of the colonoscopy, and I've definitely got to know this well. I've done about 700 of these a year for the last 20 years or so. It's a very smooth procedure. People generally kind of sleep through it. We give them some medicine. It takes about 20 minutes or so. And when they wake up, it's done, and you're done. And we've gotten a lot of information. Depending on the type of anesthesia you get, sometimes people are very deeply asleep. Sometimes people are more in sort of a twilight state. But it's a very safe procedure, and I think it's a very important procedure. It gives us a lot of direct information. It's nothing that beats kind of being able to look inside. And if you see something, sometimes you can do something about it right then and there, as we're talking about. So
if you spotted something that was suspicious, the polyps, you just want to get rid of them so that they don't turn into anything. Is that correct?
Yeah, I think it's important we're sort of talking about what's a colonoscopy like. The role it plays in colon cancer screening sort of needs to be, start from the beginning a little bit, in the sense that as people get older, we want to keep them healthy. And one of the most common cancers that people get is colon cancer. So the question is, kind of like breast cancer and prostate cancer, is there something that we can do to prevent it? And actually, colon cancer has been shown that you can really do a good job of preventing colon cancer by having sort of a routine way to check the colon. That would include doing a colonoscopy, like we talked about, every 10 years. And there's sort of other things you can do too. There's something called a sigmoidoscopy, which only looks at part of the colon, but maybe do that more frequently, like every 5 years.
So is that the same kind of prep and procedure?
Yes.
It's same thing.
And
that's why I have the whole thing.
More or less. And then sometimes people would like to do something to get like a check their stool for blood every year. And that's sort of another way.
The specimen?
Yeah, exactly. Yeah. And that's sort of a test that your primary care doctor helps you order, and it's a little kit, and you kind of send in a little sample that gets tested. But there's a wide range of ways to kind of try to prevent colon cancer. So the take-home message is, pick one of them and have a good talk with your primary care doctor. But it would include something like a yearly check for blood in the stool, or something like a colonoscopy every 10 years kind of thing.
So is there anything that we could do to prevent it? Is there anything, for all the work that I've done and the research that I've done doing shows and talks, I know that smoking seems to be a number one for any cancers or any illnesses, even stroke, heart attack, things of that nature. Does that put us at risk for the colon cancer as well as other things like smoking or any other thing that we might do? Sure.
One thing I would say in terms of colon cancer is that there's a natural, the colon takes sees a lot of stuff over the course of a lifetime, and that can be irritating, and that we think kind of sets up, a kind of that's why colon cancer is so common, is because we think that, the changes over time for anyone, can make people at risk for forming little polyps that kind of sit there for years and years and sometimes grow and turn into colon cancer. So that's why we strongly recommend checking for polyps with colonoscopies or with, blood tests in the stool, so that we, prevent people from going to that point where they have a colon cancer. Most people can't really, they won't develop symptoms until it's very late. So. And there's really good science out there saying that if you do one of these prevention programs, it can do a really good job of trying keep people from getting colon cancer.
Wonderful.
That being
And
said,
even if you get colon cancer, maybe a good chance if you catch it in the early stage too.
exactly,
Right.
it's very treatable. That being said, in terms of general advice, probably, certainly avoiding, smoking can increase the rate of colon cancer. Excess alcohol use can. Obesity is thought to contribute to it. Things like exercise are thought to maybe help prevent it. And there's some data also on charcoal meats and processed meats, like sort of salamis and things like that. We feel that in sausages can sort of maybe increase the risk a little bit, but you gotta it's everything in moderation.
Exactly. Exactly.
I wouldn't fear a grilled hamburger once in a while, but it's kind of a regular consumption of alcohol, tobacco, those kinds of things can put people at risk.
At risk.
Theoretically, at a higher risk.
Yeah, at a higher risk.
But
so, are there any other conditions or diseases that one might get of the colon or the bowel?
oh yeah, I mean, there's sort of obviously there's a lot of different things that can affect people. We sort of talked about what people commonly experience, problems with constipation, and
Right.
As people get older, sometimes they have problems controlling their stools,
Right.
and that's kind of a difficult but potentially treatable problem too.
Really?
And it can be embarrassing to the patient, and can cause problems with lifestyle. People don't want to leave the house, that kind of thing, and a lot of that can be looked at. Not everything can be perfectly cured with a pill or surgery or something like that, but it's usually between sort of looking at medications and diet and stool habits and possibly a colonoscopy. Usually we can kind of give people enough information and to recommend a treatment plan that can sometimes really change people's problems with that.
That's wonderful.
So again, I would.
So there's hope. So always, and as Dr. Becker mentioned, that's why it's so essential to have a good and strong relationship with your primary care physician, because they're the navigator through the entire system. That's how someone would get to you. Is that right? Through the
That's right.
primary healthcare provider.
I think as we sort of touched on before, especially as you get older, there's a lot of things going on in one's life, in terms of changes in the way people eat, medications that people are on, natural kind of wear and tear of things in the body. And there's so many different things going on that it really does help to have a primary care doctor sort of act as your quarterback or the guy in your corner to kind of help guide you and toward the right specialist if need be.
Wonderful. Now, I know that there's the disease or the condition called IBS, irritable bowel. And one thing that surprised me was that you could either, and usually we think of it as that you are always running to the toilet, but I know that constipation, you can have IBS and be constipated, which surprised me because I thought it was just the opposite. So it can be either or.
That's right. So sometimes you hear the word irritable bowel syndrome, and we sort of think of that at least from my point of view as a surgeon, as what people have a certain set of symptoms. It can be crampy stomach pain, it can be diarrhea, it can be constipation, or some combination of all those things. And there may be a clear cause that we can recommend to sort of help people get better. Or there may be a specific disease that's causing that, or a medication or something like that. When we've looked at everything and we can't figure out, there's no clear reason, that's when we sort of call it irritable bowel. In other words, that means that we really haven't found anything wrong, except that the patient's kind of suffering from these different things. And in that setting, we sort of make some recommendations to treat that. And sometimes it's simple as things like sometimes just adding fiber. There are some specific medications that can help with some of the spasms of the colon, or that can help with sort of get the colon moving, That's usually handled by either a primary care doctor or a gastroenterologist. It's not necessarily a surgical problem.
Right.
But again, that's what we call it when we haven't been able to give it any other diagnosis.
I see. So we have a few minutes left. And is there anything else that you want to touch on? Something that might be really important for our folks to know with respect to any of the conditions that people might get, or procedures, or if they have surgical procedures? Oh, I know. Do you have anything else before?
No, I'd just say that, one thing I've noticed in my field of colon and rectal surgery is that it's an area where I think everyone at some level has some problems or some questions about their colon and their bowel function. And if they're bothering them, then they should kind of don't be afraid to speak up on it, because there's a lot of treatment. I think these things tend to people feel a little embarrassed, or it's an area that they're not socially comfortable talking with. But it can really cause people a lot of problems over a long term. And for something as simple as hemorrhoids, I've seen patients that have suffered for years, and we finally do something about it. And they're like, I can't believe I didn't get this looked at sooner.
Right. So
that's number one. Number two is, in the end, the biggest thing that's of concern is colon cancer. Because as I said before, it's a very common cancer. It's the second most common cause of cancer death in the country. And what's interesting about it is very preventable. And people don't realize that. And I think that it has to do also with not wanting to sort of talk about colons. But, people should definitely talk to their primary care doctor about getting screened in a preventive way. We're not expecting to find something terrible. We might find something that we can deal with, like a polyp or something which is easy to remove, that can help people not get colon cancer. And it's very satisfying to be in a population where there's a good primary care structure, because they do keep a good job of keeping track of their patients and recommending screening programs for them.
Right, so be sure to talk to your primary care physicians and let them know everything that's going on with you, because it may be help, and the sooner we catch anything, the better off we are. Well, we want to thank you so much. Thank you so much for coming on board.
My pleasure.
A wealth of information to our folks here, and hopefully we'll see you next time. Thank you so much.